The recording has just begun.
Fabulous, thank you. All right, good morning, folks. I'm calling the remote committee of the House Committee on Behavioral Health to order. It is Wednesday, March 17th at 8 a.m. Hey, we made it on the dot. So we, of course, are going to start with the roll. Again, folks identifying how they are present and participating, whether that's on the phone or on video. Please remember to unmute yourself. Give that half a second for the mute to try to play nice with us. And also remembering to keep yourself on camera as much as possible. Those of you on the committee. If you're not on the committee, it's okay if you keep your camera off. Please make sure your mute button is operating at optimal capacity there so that we don't have any background issues. Please remember also that the chat box should not be used for communication as much as possible. It is not recorded, so we won't have that information available to us. Most of the time I'm able to see the hands raised functions because I keep that little side panel open as much as possible. So, Hayden, can we go ahead and call the roll, please?
Yes, Madam Chair. Representative Lively?
Present by video.
Representative Morgan?
Well, we don't have Morgan or Wright.
Representative Morgan?
Not here yet.
Representative Reynolds?
Rep Reynolds here by video. Good morning.
Representative Salinas?
Representative Salinas is here by video. Good morning.
Representative Solomon?
Top of the morning, Representative Solomon is present by video.
Representative Wright?
Representative Wright is here by phone. I'm having technical difficulties. Thank you.
Vice Chair Moore Green?
Good morning, Vice Chair Moore Green here by video.
Vice Chair Nose?
Vice Chair Nose here by video.
Chair Sanchez?
Present by video. Thank you. Okay, folks, we are going to get started here. We have, I'm going to open a public hearing on House Bill 2086. And Zoe, can you give us a little bit of information about this, please?
Yes, Madam Chair, members of the committee, House Bill 2086 directs OHA to design a statewide crisis system, appropriates general fund money to Oregon Health Authority to establish specified behavioral health programs, directs OHA to continually evaluate and revise administrative rules governing behavioral health programs and services to reduce the administrative burden of documentation for providers seeking certificates of approval, directs OHA to create behavioral health incentive fund for recruitment and retention in the behavioral health care workforce to increase the number of people of color, tribal members, and rurally based workers. Requires OHA to increase access for services for rural and underserved communities, implement and sustain culturally based practices, and develop curricula for behavioral health workforce in specific areas. Requires OHA to report to Legislative Assembly no later than February 1st, 2022, with recommendations on achieving living wage for behavioral health care workers. Transfers Housing for Mental Health Fund from the Housing and Community Services Department to OHA. Directs OHA to adopt rules for coordinated care organizations to provide housing navigation services and address the social determinants of health. Appropriates general fund money to the Mental Health Fund to provide incentive funding for the development of new housing, including long-term care, short-term respite care, and independent and integrated housing. Appropriates general fund money to OHA to increase funding for rental assistance to create a residential fund to fill gaps in the residential continuum, aids transition from inpatient care or correctional facilities to the community by providing residential support for those who do not meet the criteria for assertive community treatment, and to fund 3 secure residential treatment facilities. Declares emergency effective on passage.
Thank you, Zoe. So, as I'm sure folks remember, this is one of the bigger bills and a few things that we needed to move forward, of course, in the whole behavioral health realm. And we are going to start with Jackie Yearby, Office of Governor. Jackie, go ahead, if you would, please.
Okay, good morning. I'm trying to come off mute here. Good morning, Chair Sanchez, Vice Chair Moore-Green, and Vice Chair Nose. My name is Jackie Yerby, and I am the Governor's Policy Advisor for Behavioral Health and Health Licensing, and really grateful for this opportunity to speak with you today regarding House Bill 2086, which contains the recommendations that came out of the Governor's Behavioral Health Advisory Council. And as you may recall, the governor convened the Behavioral Health Advisory Council in October of 2019. The world looked a little different, or maybe a lot different then. We approached the work wanting to, encouraging the Governor's Behavioral Health Advisory Council to kind of make the next big recommendations for the next big set of investments for our behavioral health system. The group brought together the consumers of behavioral health services, tribes, practitioners, hospitals, and CCO representatives. I also want to highlight work that was done to engage persons with lived experience. And although I was not involved from the beginning of the council, having joined in the late summer of 2020, the discussions and deliberations were greatly enriched by the involvement of individuals with lived experience. And Director Steve Allen in the Office of Consumer Activities at OHA held numerous listening and feedback sessions, worked with the Consumer Advisory Council, and had numerous discussions with consumers. And I'll just pause and say, I'm looking at all of your faces, and there is a slide presentation. So I just want to pause and see if we could bring that up. Okay, thank you very much. And if you could go to the next slide, please. Thank you. Okay, and this is where we are. Just continuing, so the youth voice was prevalent and respected, including a survey and Youth Advisory Council statewide summit to provide input on the direction of the council. Next slide, please. So the charge of the Governor's Behavioral Health Advisory Council was to develop recommendations aimed at improving access to the effective and responsive, effective and responsive behavioral health services and supports for all Oregon adults and transition-aged youth with serious mental illness or co-occurring mental illness and substance use disorder, and it aligns with Director Allen's simple, responsive, and meaningful framework. As you know, improving access to behavioral health services and reducing health inequities is a top priority for the governor, and the council has adopted the Oregon Health Authority's Health Equity Statement to frame its approach to health equity. Next slide, please. Before I turn it over to Director Allen to talk about how the recommendations were developed, I want to recognize that this is not the first set of recommendations related to behavioral health in Oregon. So in bringing the council together, the governor sought to build on past recommendations and existing strategic plans to decide on the next best investments for Oregon. In particular, there was an effort to align the ADPC strategic plan, so the Alcohol, Drug, and Policy Commission strategic plan, the Tribal Behavioral Health strategic plan, and the state plan. Obviously, the pandemic and its disproportionate effects on communities of color and health equities into greater focus as the council deliberated and prioritized its recommendations. I also want to say that in early fall of 2020, the governor convened her racial justice council, including a subcommittee on that addressed health equity. And so when I became the behavioral health advisor in late summer of 2020 and entered into this work with the Governor's Behavioral Health Advisory Council, I also shared that the recommendations of Behavioral Health Advisory Council would be vetted through a racial justice lens by the Racial Justice Council Health Equity Committee. Next slide, please. Thank you. So the Governor's Behavioral Health Advisory Council landed on 6 areas of focus to craft and develop recommendations, and you can see them here. So the areas where we need to improve availability of support and investment include programs and services, housing and housing-related supports, and workforce. And then the areas where we need to improve effectiveness were data and outcomes, accountability, and funding and incentives. The council developed a work plan where the council would divide itself into affinity groups to tackle each area, and they decided to deliberate on 3 affinity groups at a time, starting with housing, workforce, and programs and services, and then moving on to data, outcomes, funding incentives, and accountability. Unfortunately, because of COVID, and this is in the early days of COVID, before we figured out how to do virtual meetings, and also just given capacity issues between the governor's office and the Oregon Health Authority, the Governor's Behavioral Health Advisory Council went on hiatus, and so the data, outcomes, accountability, and funding and incentive affinity groups were not able to meet. So I am going to, before I transition over to Director Allen, he will talk you through the recommendations, and I just want to say that we saw all of the recommendations as valuable, but we were unable to carry some of them into the governor's recommended budget because of the realities that we were facing last fall when we were putting the budget together. And thankfully, due to our partners in the legislature, there are other players that have been able to pick up those parts. And with that, I will turn it over to Director Steve Allen.
Good morning, Chair Sanchez, Vice Chair Nose, Vice Chair Moore Green, and members. My name is Steve Allen, Behavioral Health Director for the Oregon Health Authority, and happy to be here with you today. Thanks, Jackie. Next slide, please. So the lens at which I'll run through these recommendations include all of the recommendations that came out of the Governor's Behavioral Health Advisory Council. And what you'll see is that in what I interpret as the strength of these recommendations, the good share of these have been picked up in various legislation. So they're not all in one place, but they are picked up in a variety of places throughout. And so I'll begin by talking about those recommendations that either didn't need funding or legislation, those that have been picked up in other legislation other than 2086, or those that currently don't have a home, so to speak. And then I'll circle back around to those on 2086. I'll also apologize in advance. I have to move over to Ways and Means at 8:30, so happy to take any questions or things that need attention that I can't get to today offline. So beginning with programs and services recommendation, there's a state-funded pilot to create 3 non-clinical peer-run services. These respite services, these are provide low barrier access to residential level of care supported by peers. This is a program that has been active in other states. This is currently incorporated in 2980, Representative Hayden's bill. Expansion of the early assessment and support ESA program from a 2-year to a 3-year program wasn't able to be funded in the governor's recommended budget. Funds to double the size of those young adult hubs, which provide mental health services, case management support for disconnected youth wasn't available to be expanded through the governor's recommended budget. Next slide, please. The council recommended ongoing funding for the CCBHCs. We did receive emergency board funding through the end of June for those programs. That's being picked up in Representative Nose's House Bill 3123 for ongoing funding. and the ongoing development of the Oregon Behavioral Health Access System. We didn't need funding for that, state funding for that. We were able to use CARES Act funds. The initial phases of that one-stop shop for all behavioral health website aspects of that went live in September, and building on that, and we expect the full website now to go live shortly in the next month or two. It's currently still under development. Next slide. In terms of the housing increased access, I'll come back to 2316 in the next slide. Funding for rental assistance. The council recommended additional residential SRTF level of care that's partially funded, but there's an inventory in House Bill 3070 to look at what additional needs that we have. The council recommends a pilot to create 3 clinical peer-run respite centers. That's that same bill we just talked about with Representative Hayden, and there was overlap in what we called the affinity groups, where different groups saw the same challenge and supported it from multiple directions. That was one of those. Next slide. Recommended that, and this is this 2316. So this has 2 parts: the transfer of the Housing for Mental Health Fund, which is currently in the Housing and Community Services Agency, and to move over to OHA along with funding. And I understand there is a modest funding that's coming over from that that will at least get us started in that regard. And then the CRADE CCO requirements for housing navigation and social determinants through care coordination. No legislation is needed. We have our 1115 waiver that will be under development this year, so we'll renegotiate with CMS around that, and then we will have the opportunity to revise our contracts with the CCO, so no legislation is needed, and at this time, we're not requesting funding. Next slide. In terms of workforce, the bulk of the workforce recommendations have been moved into Representative Bynum's House Bill 2949. And so the incentive fund increase and Representative Salinas also has House Bill 2361 with a focus on our Latinx communities in a focused set of counties. The council recommends OHA implement and sustain culturally based practices. Again, in 2949, the 309 rule revisions to reduce provider administrative burden. We don't need legislation or funding to do that. We're exploring those revisions internally. Next slide. Workforce should be trained in a variety of practices so that we not only have a stronger, broader workforce, but a more well-trained workforce, and those aspects are included in both bills, 2949 and 2361. In developing an outcomes-based system to demonstrate anti-racism and equity training. And again, this is not an area where we need funding or legislation, and we're working internally at OHA to bring that into fruition. Next slide. Additional legislation that's related, and I apologize for the spelling on the Governor's Behavioral Health Advisory Council in the header. The provider grant program, that's currently included in 2949. The inventory assessment of residential capacity, that's incorporated in 3070, and a needs assessment to conduct mental health provider education programs, that's also included in 2370. Next slide. In terms of, so now we come to the Governor's Behavioral Health Advisory Council recommendations that are included in House Bill 2086, along with the Governor's recommended budget funding allocations. So the first is for Medicaid reimbursement for tribal-based practices. This gets at the issue that the approaches that have the strongest research and evidence are those that tend to be supported by the dominant culture. Those tribal-based and other culturally specific practices haven't got as much attention. And so this is about exploring those tribal-based practices and beginning to look at how we can fund them through Medicaid and also do additional research on outcomes. The second is increased funding for community restoration, aid and assist. There's sort of a four-part plan here. First, we don't know enough about what's been driving this really significant increase in people under aid and assist who are arrested, go into jail, and determined not to be able to aid and assist in their own defense. We think we've not paid enough attention to the impact of drugs, especially methamphetamines, on this population. So we needed funding to do additional community research to better understand this challenge so we can address it appropriately. We've also underfunded our communities, and especially with a change in Senate Bill 24 with people at misdemeanor level who don't need hospital level of care being treated increasingly in the community level. We've never adequately funded the counties to do this work, so there's additional funding to strengthen how we fund that and to match it to the actual cost of the provision of that care. We need additional residential capacity. And at OHA, we haven't had the staff to adequately support this work, liaisons with the courts and corrections, liaison with the state hospital, technical assistance for the counties, so look at these as a constellation of populations with high intensity needs that include civil commit, aid and assist, and the GEI or PSRB population, people guilty except for insanity, all require intensive community services and sometimes hospitalization. To think of these as a broader group with obviously some differences, but for some similarities in terms of the types of community interventions that would support them successfully. And then the expansion of the young adult and transition residential system. We've invested significantly through Senate Bill 1 and other measures in our children's system, but those transitional age youth from 17 and a half to 25 haven't had the same array of services available. These would be services specific to that transitional age youth. Next slide. And some -1 amendment requests. Senate Bill 67 expands the range of housing. Typically in Oregon and often in other states, housing is restricted to those maintaining abstinence. And so this provides a range of housing that would include people who continue to use as a harm reduction strategy to meet people where they are so that we don't have people who are using in homeless. Increased funding for community restoration for aid and assist and the secure residential treatment facilities comes over also from Senate Bill 69. And repealing Senate Bill 944, this was included in the Secretary of State audit recommendations. That original bill had some restrictions that prevented it from being as effective as it could be to track data on treatment demand and utilization. And so that's also included in this bill. Next slide. And this last slide, I believe, just highlights the numbers you've already seen on the allocations coming out of the governor's recommended budget, $2.4 million for the peer respite. But again, that has moved over to Representative Hayden's bill, $1.4 million for reimbursement of the tribal-based practices, $7.5 million for the young adult and transition residential, and the $19 million for community restoration and secure treatment facilities for aid and assist. And I believe that's the last slide. Happy to take questions, Chair Sanchez, if this is the appropriate time.
I'm almost positive that it's going to be the appropriate time. Representative Morgan.
Thank you, Chair Sanchez. Good morning, and thank you, Director Allen. I appreciate the information there. I think I heard you say when you were mentioning Bill 2949, 2361 that you're taking funds away from counties and towards funding in these programs, and I'm wondering if you can speak more to that, as the counties are the local mental health authority.
Chair Sanchez, Representative Morgan, I'm sorry if I misspoke, but that was not my intention.
Director Allen, can you clarify that piece, though, specifically? I think other folks would be interested in hearing yeah.
Chair Sanchez and Representative Morgan, I'm not sure I understood. Maybe I misunderstood your question, but it is not moving funds from the counties. I'm sorry if I'm misunderstanding the question.
Chair Sanchez, may I just clarify? And it may be that I misheard you. I apologize. I have people working in the background, so I'm trying to do two things at once, so my apologies. I know currently there's funds route to behavioral health services a couple ways. They either go straight to the CCO who contracts with the agency, or they go through the county local mental health authority and contract with the service providers and such. And so I was just verifying that process is not changing, or there's not more money being routed away from the local mental health authority directly towards the service providers. And so if I misheard, my apologies.
Yeah, Chair Sanchez and Representative Morgan, that is, I'm trying to make a connection here, but that's not the intention of this bill.
Yeah, I honestly, I think there was a moment where you were talking about the sort of the counties, things that were done by the counties and whatnot, that sort of sounded like it was just a little wobbly. It's okay. I think we're there. Representative Downs. No worries.
Rep Sanchez, thank you for calling on me. And Rep Morgan, I do think there were cuts in the governor's budget to some of the county programs. And I'm frantically looking here in my laptop, trying to find that. Jackie, maybe you remember, like we had a conversation once where like tough choices, Rep knows, but I could swear there were a couple of programs that were like flat funded. And maybe that's what you're referring to. Does it ring a bell for anybody but me?
So I just want to clarify, that is not specific to this bill.
Correct. It's a budget thing.
Okay, fabulous. Representative Wright.
I think.
Exactly, Chair Sanchez and Representative Nose, in briefly talking about that, there is a 11.5% cap on basically dealing with counties and cities and school, common school fund, those kinds of things. It appeared to me that a lot of the money was rerouting around the counties. They were given a certain amount of money, but unfortunately now with the marijuana money available, they're capped at 11.5%. So to a certain extent, that's a limitation on the counties and the cities to be able to provide services. So I'm a little concerned about that, but that may or may not have anything to do with this bill. So, excuse me. Thank you.
Thank you, Representative. I don't think it does, and I want to just remind folks that we have 2 minutes left. Director Allen, he has to leave. So if there are any questions that you have specific to the pieces of 2086 that he can address right now, that'd be great. If not, I'm going to let him go ahead and go and get onto his other meeting, and we will carry on with the folks we have on our list for testimony on this bill. I know that was a lot of information as well about there's a lot of things going in and coming out of 2086. So I really want to encourage people to take a look at those amendments that are coming through for this. So because it is a pretty big bill. It's pretty complex. So anything else? I'm not seeing any other hands other than hands that are still up. Rep Nelson.
Well, Madam Chair, an advocate texted me and gave me the correct information. So I wonder if Rep Morgan and Rep Wright are trying to remember that the choice program and community mental health was flat funded in the governor's budget. Maybe that's what they're remembering. I didn't remember the name of the program, but that's what an advocate from my county just texted me. A modern way to pass a note in class, Madam Chair.
I love it. Representative Moore Green.
Thank you very much, Chair Sanchez. Just for clarification, we will be seeing amendments to this. Is that correct? Because I just checked and there's nothing listed at the moment.
Yes.
Great, thank you.
All right, thank you so much, Director Allen. We will carry on with our other folks on the list.
Thank you.
Former Senator Arnie Roeblen, are you with us, sir?
I am, and hopefully my camera and sound came on. Hello to everyone. It is really a pleasure, and for the record, I am Arnie Roeblen. I live in Coos County, and I was a former senator and the head of the Mental Health Committee in the Senate. This is a really important day from my perspective, and it is really important that you all are here to take on this really challenging problem of mental health and behavioral health in the state of Oregon. This is a really important bill. I was on the governor's task force or group, the 35 people who were there, and then added people at the end. And it did take a little respite during the early ravages of the coronavirus pandemic. I will say that it is more important now than ever that this funding get done, because all that the pandemic did was really exacerbate mental health issues, both for our kids in schools and for our adolescents and all of the people out there who are panicking with respect to loss of income, all of the kinds of things that happened because of the pandemic. I always like to make sure that I remind people that, since the Senate President reminds us every time we come together to talk about mental health, the very first bills, the very first actions taken by the very first legislature back in 1849 was to build a mental health hospital. They knew in the early parts of the last century that there was a need for the state to take ownership in helping deal with people with mental health issues. That continues to be the case, and we've done a lot over the last number of years to fix the hospital system, to do other kinds of things. But we know a lot more now than we did in 1849 about behavioral health and mental health, but we haven't really funded it the way we appropriately should. You have a number of bills, not just this one. This is kind of the mainstay of that work. But as you saw, there's respite care. There's our HBHCBCs, I can never say that correctly, that Representative Nose's bills take care of. Those are really, really important aspects that have to be continued and have to be worked on. So when I heard that this was happening and we're having this mission, I felt obligated to continue the work that the president allowed me to get involved with 2 years ago. And I am excited to see you here taking up these really big issues, and I encourage you to get the resources necessary to move forward. We have waited too long to meet the needs of Oregon citizens that have behavioral health issues, and we need to make sure that we get it taken care of. I am excited about seeing the issues with regard to Native Americans. They are working on this issue internally in their tribes and across the nation, and coming up with new and better ways to meet the needs of their people. This bill addresses that. So over and over again, if you look at what we've done, and if you look at the work that Steve Allen and the rest of the people put together in making this commission work, you are seeing a systematic attack at finding the solutions that we need to have and to make Oregon the place it should be with regard to taking care of all of our citizens. So thank you for the opportunity. Thank you for all of the families that are out there waiting for help. That's why that respite one is so important. Many of our most severely ill people are being taken care of in the families' homes, and they need a break from time to time, and making sure that those places are available. We also know, not only in physical health, but in mental health, that having housing is singularly the most important thing to help them stay their lives and get things back in order. When I first took on the committee, I was shocked at how many people, lobbyists, community members, and other people came and talked to me individually and personally about the stress in their lives with individual family members. And having a brother that has consistently had a problem with bipolar disease, recognizing that it is part of who he is. And the other thing that Steve Allen and the committee did that I thought was really, really important was making sure that those people with mental health got a voice in this committee. Towards the end, we heard some really great testimony from people working with their own individual issues and asking for help in the appropriate ways. So continue to ask and listen to people who have and are struggling every day in their lives. continue to do the good work, and I encourage you to pass this bill. So if there's any questions, I have to do it. I have to go to a dental appointment, so I would rather be with you than with the dentist.
Thank you so much, sir. So very good to see you. Bye-bye.
Bye-bye.
Okay, the next person in our list of folks is Ebony Clark. Ebony, are you with us? There you are. Fabulous. If you could remember to state your name for the record, please go ahead.
Good morning, Chair Sanchez, Vice Chair Moore-Green, Vice Chair Nose, and members of the committee. My name is Ebony Clark, and I'm the Interim Health Department Director for Multnomah County. I also serve as a member on the Oregon Health Policy Board, and I served on the Governor's Behavioral Health Advisory Council. I'm happy to join you today to show my strong support for House Bill 2086. This bill provides a wealth of hope to Oregonians in need of quality behavioral health care. It strengthens our behavioral health services infrastructure, opens doors to communities previously neglected. The potential for positive outcomes from this bill is enormous when coupled with adequate funding and intentional language to encourage and ensure consistent and equitable implementation. The three original elements of House Bill 2086 that I would like to also call out, specific to peer respite, supportive housing, and workforce. I understand that these pieces are moving forward in other legislation, but I also want to express my support nonetheless. Peer respite is a critical piece of the behavioral health continuum of care, offering trauma-informed settings where individuals can get much needed support. Each day, staff from our behavioral health division hear from the community members who tell us that peer respite offers a step towards stabilization and helps individuals identify the supports they need in their own recovery. We also hear about the trauma experienced in the hospital settings that can make people reluctant to seek out care. When implemented thoughtfully, peer respite facilities provide a safe, community-based environment that allow clients to begin healing before they reach and have to touch crisis points, which then require hospitalization. I also want to highlight that peer respite has been recommended by the Oregon Consumer Council. It was also recommended by the Governor Behavioral Health Advisory Council and Governor Brown's Racial Justice Council. Supportive housing is a foundational element of behavioral health care. Access to safe, reliable, and affordable housing sets the stage for recovery and healing. Ensuring that wraparound services are paired with housing will strengthen our communities by investing resources within those communities. Finally, I have been before you to talk about the need for a robust behavioral health workforce that meets the needs of all members within our community. Today, I want to emphasize that in order to recruit and retain high-quality talent, behavioral health workers must be paid a living wage. At Multnomah County, we hear many stories of community-based providers losing staff to higher-paying hospital and health system positions. I've also heard from providers that they've discovered several of their employees are houseless themselves, living in tents while working these lower paid jobs. Paying the workforce adequately means not only that we keep skilled and experienced professionals where we need them most, on the front lines of our behavioral health safety net system, serving the most vulnerable members of our community, but that we aren't further contributing to the houselessness crisis. Thank you for this opportunity to testify. I'm happy to answer any questions, and I too have another meeting to get to. Thank you.
Thank you, Ebony. The sad reality of the Zoom world now, we have meeting after meeting after meeting, so I think we're good. Thank you so much. Scott Winkles. Scott, are you with us?
I am. Chair Sanchez, members of the committee, for the record, I am Scott Winkles, representing the League of Oregon Cities, and I am appearing in support of House Bill 2086. I heard a couple of comments earlier about the COVID causing a greater strain on our behavioral health system. Not to put too fine a point on this, but early on in the pandemic, Portland Police and Fire reported a 41% increase in attempted or threatened suicide calls in the first month of the pandemic during the initial phases of the lockdown. I wanted to hammer that home to illustrate exactly the extent in which local governments are responding to this crisis. While the League of Oregon Cities typically and historically haven't been a mental or behavioral health provider, that is changing, and it's changing rather rapidly. I will draw your attention to the workforce investment section of this bill. We have cities across the state who are looking to emulate a Cahoots type model or a emergency care. Essentially, I'm viewing them. I hope this pays them a compliment. It's intended as another member of the emergency services community, of the emergency response community, and we are going to develop this workforce over the coming years, or employ these programs. We do not believe now that there are enough trained, qualified people to perform these functions or sufficient resources to compensate them at a level that will retain them and pay them at a wage that is commensurate with their with that value to the public. So increasing this workforce and those incentives is incredibly important. I also say with gratitude that the bill requires that rural services, that we develop the workforce in rural Oregon. I had the privilege of traveling the state, talking to our members about their issues, and every city manager, every law enforcement executive we talked to, whether it was in Burns or in the coast or in Southern Oregon, in the Gorge, reported that they have seen in their careers a remarkable increase in the number of substance abuse calls, mental health calls, behavioral health calls, attempted suicide calls. And we're sending police to these instances that we don't want. That's not the appropriate responder. Maybe there is in some way, they need to be there in certain instances, but that's not who's going to resolve this. And with that, I'll transition into the respite facility care investments. I understand that there is another piece of legislation that is more likely that will have a different structure to the respite care. I can't stress enough the desire of the League of Oregon Cities, and I do believe I speak for most of our law enforcement professionals in the state, where we need somewhere other than jail where people can go. Again, we hear stories and anecdotes around the state of people in serious crisis who are a threat to themselves or others, but there's not a criminal. This isn't criminal activity. This is medical. This is a medical issue, and the options that we've been given in order to keep a person from harming themselves or another is, unfortunately, it's custody, which is not appropriate and doesn't help anybody. So we understand that this conversation will likely proceed in Ways and Means. We will be there to advocate for adequate funding levels. And with that, I will take any questions.
Thank you. Are there any questions for Mr. Winkle? Nope. Well, thank you so much for your testimony, sir. Eva Ripito, are you with us, dear? I'm looking around for the squares. There you are.
Here I am. Sorry, I was following along. Good morning, Chair Sanchez, Vice Chairs Moore Green and Nose, and members of the committee. I'm Eva Ripito, Oregon AFSCME Council 75 Political Coordinator, and this is my cat, who has decided that she needs to be in my face this morning. Oh, good, now she's done. Thank you for this opportunity to provide testimony on House Bill 2086. Oregon AFSCME appreciates the work that you all and the governor and the Behavioral Health Advisory Council have done and continue to do to address our state's behavioral health needs. Oregon AFSCME Council 75 represents around 24,000 members statewide in a variety of employers, both public and private. In behavioral and mental health fields, we have over 2,000 members, with our largest growth in membership over the last few years in the nonprofit behavioral health sector. This growth in membership began with the collaboration between represented and non-represented workers in the field on the United We Heal report that was released in the spring of 2017. The report highlighted the growing needs to provide improved services through better investments and policies that would stabilize and expand the workforce.
Since the release of that report, we've been focused on researching how to best support our members through policies. Many of those are reflected in HB 2086 and many of the other bills you are hearing and working on this session. At our United We Heal Behavioral Health Legislative Forum that was held on December 1st last year, our members highlighted many issues that you have heard repeated by all who have provided testimony today and previous days. We need to increase pay across the board in these services. Our lowest paid behavioral health workers make barely more than minimum wage. It is skilled work and needs to be paid as skilled work. And when we're not doing that, we lose people and harm the continuity and quality of care provided to people needing services. We also highlighted the need for other future workforce issues, like looking at caseload standards and workload standards that would help keep people able to provide the best quality of work by ensuring that we are establishing some sort of standard of care that keeps people able to stay in the field and not burn out quickly. We know that that's a longer term strategy that will need to be looked at over the next few years. Additionally, our members were concerned about housing in this area. They were primarily focused in the forum about spaces available at all levels of care so that people don't have to wait for months to be in the right level of care that they need. By focusing on supportive housing, this would help reduce the wait times in other areas too. While it is critical for the success of treatment of an individual, this is also a workforce issue. When we have people in the wrong level of care, supported by residential employees trained at lower levels of support, this can lead to a variety of issues in ensuring that the residents' needs are met properly, and then that others in the setting are given the time and care to address their needs as well. So it spirals for a lot of the people in the settings when we don't have people in the correct setting and the correct level of support and training for the workforce. The other piece that I would like to highlight in HB 2086 is workforce development. Unions often play a role in offering workforce development opportunities. AFSCME's Behavioral Health Coalition, United We Heal, named after our report, has offered continuing education opportunities as part of other events and have been looking to expand this program and build a training fund that would support behavioral health apprenticeship programs. We have two proposals for 2-year apprenticeship pilot programs that would each support 2 one-year cohorts of 36 apprentices, 1 2-year cohort of 12, and 1 2-year cohort of 12. Sorry, that's a mouthful. One program would focus on providing culturally specific training and support our members who are Black, Indigenous, Latinx, or from other marginalized communities. Combined, the two programs would train up to 96 people. Each program would support the training of 36 workers in 12-month or less certification advancement programs, support the training of 12 workers in a 2-year-long degree program. And of course, we couldn't do this without partnerships from the state and employers, as most apprenticeship programs have this kind of partnership and investment. Each pilot program would also include 3 cohort levels. Someday I will learn how to say cohort. Level 1 focused on helping peer support workers and other entry-level workers advance the role of addictions counselor. Level 2 focused on helping workers in entry-level positions with 2 or more years of experience move into roles as residential counselors or secure residential treatment specialists. And level 3 supporting bachelor's level employees to complete a master's degree program and become eligible for QMHP licensure. Each participant would earn a livable wage as part of the program, removing the dual financial burden of cost to enroll in classes and cost of missed hours of working. The program is modeled after a training and apprenticeship program created and run by AFSCME Local 1199C in Philadelphia, Pennsylvania. The program was started in 1974 and has grown to offer apprenticeships, training, and continuing education in a number of fields, including behavioral health. Oregon asks that you make, oh, sorry.
Can I get you to
yeah, wrapping up now.
Thank you.
We just ask that as you're making these important policy decisions for supporting workforce development and improving care, that you include these apprenticeship programs as a way to ensure that we truly support the workforce and help Oregon meet its goals of growing and diversifying our behavioral health workforce. Thank you.
Thank you. Sorry about that. We have a couple other folks. And Paige Spence. Paige Spence, are you with us?
Yes. Good morning, Chair Sanchez. Can you hear me?
Yes.
Great, thank you. Good morning, Chair Sanchez and committee members. I am Paige Spence here on behalf of Washington County's Community Mental Health Program. Thank you for the opportunity to testify in strong support of House Bill 2086 with what we understand will be the -1 amendments. Thank you to all of you, Senator Roblin and the Governor's Office and the Behavioral Health Council for your work on this bill. I wanted to touch on two components of the bill that we're particularly supportive of. The first is aid and assist, and the second is workforce. With aid and assist, our aid and assist team at Washington County over the past year has supported hundreds of patients, both who were served at the Oregon State Hospital and through community restoration. We completed hundreds of court-ordered restoration consults, which each include detailed records review, interview, report writing, and submission to the court. However, our IGA with the state only provides funding for 2.5 FTE under the service element for all that work, which is just not enough to support our workload, especially because our aid and assist population is growing on an annual basis, and we currently have upwards of 40 folks in the state hospital on aid and assist at any given time. And so we really encourage you to support the funding in House Bill 2086 to support the clients in our community and also help coordinate care for clients as they are discharging from the Oregon State Hospital under what can be incredibly complicated circumstances. The second is a workforce shortage. This is very exciting for us to see in House Bill 2086. As you've heard from others, workforce shortage is one of the primary barriers to our clients being able to access the necessary care in the community. We have seen a significant number of clinicians leave the workforce during the pandemic, and then know that behavioral health workforce, of course, is not paid in line with the workforces in physical health, such as nurses, and often require a higher level of education and credential to meet the requirements for providing care. So we are just absolutely thrilled to see the work that's being done around aid and assist and workforce and other components of this bill, and encourage your strong support. Thank you so much again for the opportunity to provide testimony.
Thank you, Paige. Kevin Fitz. Hi, Kevin.
Yeah, hi. Can you hear me okay?
I can hear you, yes.
Yeah, very good. Very good. Good morning, Chair Sanchez and members of the Behavioral Health Committee. My name is Kevin Fitz. I'm a volunteer with the Oregon Mental Health Consumers Association. I'm here to testify in support of HB 2086. Thank you to Governor Kate Brown, Oregon Health Authority Administrator Pat Allen, and Behavioral Health Administrator Steve Allen for inviting me to participate and be a council member October 2019. Thank you very much. I appreciate that. Also, I appreciate the opportunity to serve on this council to help bring a greater voice to consumers and peers and survivors across the state to this process. And I was very thankful that they helped accommodate and lift the voices of consumers of your mental health system. So like I said, I'm 100% supportive of this bill, particularly around Medicaid and Oregon tribes, and also the aid and assist parts of this, which I think are crucial. I do want to say, though, one of the reasons why I was very grateful to participate on this council was to raise the voice of non-clinical voluntary support care homes for people in intermediate forms of psychiatric crisis, i.e. peer respite. And want to just say that I think it's fundamentally important that you as lawmakers understand that 3 major councils within the state of Oregon, the Oregon Consumer Advisory Council, which was started by the legislature, a legislative mandate in 2010, 25 members endorsed peer respite as something they wanted to see the governor fund in legislative session 2021. Then again, like Steve Allen said, the governor's Behavioral Health Advisory Council, 2 of its work groups and its program and services recommended peer respite in the 2021 legislature. And also, finally, Governor Brown's Oregon Racial Justice Council also recommended peer respite. So I just want to put that out there, that there was strong support from these three major councils for the issue of peer respite to be heard and ideally funded in this legislative session. Want to say, to clear up the record, peer respite is not a substitute for those in severe danger to themselves or others for hospitalization. But on any given day, especially in the Portland area, there's an awful lot of people who go seeking emergency psychiatric services, but don't meet medical criteria, but could benefit from something intermediately that gives intermediate supports that's non-clinical. So therefore, potentially heading off an episode a week or two later where they do need intensive medical care and supports. Thank you very much, Council, Committee, and Chair Sanchez for allowing me to testify today. And thanks again so much for Steve Allen and Jackie's leadership of the Governor's Behavioral Health Advisory Council. And it's been one of my things I'm very proud of, is being invited to come back and serve on councils, even though people might think, that I'm here just to push the consumer viewpoint, and they've heard it before. So, but that's me. I'm here to talk about how services impact the consumer and how we can help those people heal best as possible given our circumstances. Thank you again.
Thank you, Kevin. Actually, your voice is very, very important in this current process, and in all those processes, the bills and the laws that we make in the Capitol affect people on the ground, and that is a primary issue, and it should be for everyone here. I want to just check in. Zoe, do we have anybody else who made the list at the last minute, or are we good?
No, Madam Chair, I don't have anyone else on my list.
Wow, thank you so much. So, folks, I want to give you an opportunity to sort of, we have a little bit of time. One of our bills that we were going to work today apparently does not have its fiscal ready, so we only have one more bill to work. Just want to give you an opportunity to talk about this bill if you have questions or concerns. And I'm not sure when we're going to see that -1 amendment, but I'm assuming it will be soon. I really encourage people to read through that. I'm very interested in it myself, just to make sure that everything moved the way we needed it to move. It looked like from Director Allen's presentation that that was all lined up really well. I think the bill was big, of course, but the changes and the recommendations that were made, moving things in different directions and pulling in other things, I think have made it a stronger bill, certainly. So, thoughts, questions of anyone? I think Jackie might still be here if we have a question or two for her, hopefully. She's here. Oh, there she is. There she is. So, or are we good? Oh, Representative Wright.
Get my technical issues dealt with here. I love technology. Well, as being a newbie, as you meet with organizations and agencies, top of their list is housing, affordable, accessible housing. And I think this bill addresses that to some extent, but I think as we look forward in the other committees that we deal with, I think that's something that we need to prioritize. We need to figure out how to support landlords and making it attractive to make sure that they want to rent, that they want to house daycare facilities and those kinds of things. So I think that that's a factor that in every committee we probably need to think about and consider and make sure that we're heading in the right direction, because without housing, a lot of things aren't going to be accomplished. So thank you, Chair.
Thank you. Any other questions or comments about this particular, any piece of this bill, 2086? If not, I'm happy to close this public hearing and we can move on to, oh, there we go, Representative Morgan.
Thank you, Chair Sanchez. I think it's hard to know what all questions without the amendment. So I'm hoping we'll have an opportunity when we get the amendment to go further, but I know we have to go this direction. So I really appreciate getting the presentation so far.
Sorry, I was on mute. Assuming that that slide presentation is also on OLIS, we can at least take a look at that and sort of go over what some of the things that we know are those recommendations, and assuming that they are going to obviously make all of those particular amendments, Jackie? Yes. So that's at least until we get that. I'm not sure when we'll get those amendments back. Any ETA on that at all, Jackie, do you know?
I don't know, Chair Sanchez, but I will check and get back to you. And before you close the public hearing, I just want to say how much I really appreciate your leadership in this area. Like you just, your background, the work that you've done prior to the legislature has just made you such a great partner in just, recognizing the need to do more and better in our behavioral health system, and just the way that you've centered communities that have been disproportionately impacted and recognize the collective trauma that we've experienced about COVID. So I'm excited to be doing this work with you and members of the committee, and I'm surprised you haven't referred to your puzzle pieces and fitting all these different puzzle pieces together to move, a comprehensive package of behavioral health pieces to make a difference for Oregonians.
Absolutely. Well, let me just say, those of you who, heard me make that reference before, if you literally looking at those slides, I'm like, yep, that piece goes there and that piece goes there, and all of those different pieces that can actually make up at least a comprehensive system for what we're talking about in this moment in time. And then the other pieces, as Representative Wright mentioned, sort of the early childhood pieces or the child welfare pieces or the criminal justice pieces, all of these different things are interrelated in some way, shape, or form. And I think we're just at the, we just found some pieces that fit together really well right now. So we have maybe one little corner of a puzzle starting to come together. And I think that's really the important piece of this. So thank you very much, Jackie, for all your work on this as well. So unless there are any more questions or concerns, I'm going to close the public hearing on House Bill 2086 and open a work session on, I believe, it is the 2585, correct, Zoe? That's the one we have paperwork for?
That is correct, Madam Chair.
All right, opening a work session on House Bill 2585. Zoe, do you want to give us some information about that?
Yes, Madam Chair, members of the committee, House Bill 2585 establishes the Mental Health for Deaf, Blind, and Hard of Hearing Individuals Bill of Rights, directs Oregon Health Authority to provide culturally and linguistically affirmative mental health services to deaf, blind, and hard of hearing individuals, prohibits denial of culturally and linguistically affirmative mental health services on the basis that an individual has residual hearing ability or previous experience with other communication mode, requires deaf, blind, or hard of hearing individual admitted to hospital or residential treatment facility be assigned qualified staff member with primary responsibility for coordinating and implementing treatment plan, directs OHA to appoint advisory committee to make recommendations for statewide access to culturally and linguistically affirmative mental health for deaf, blind, or hard of hearing individuals, requires members be appointed by January 1st, 2022, directs OHA to adopt rules for minimum standards for certification of healthcare interpreters qualified to provide sign language interpretation in mental health treatment setting, declares emergency, effective on passage.
So I'm sure you all remember this, and I'm sorry for there's something going on outside my house. I'm sure you will all remember hearing this bill and recognizing so many issues, interestingly enough, or sadly enough, I should say, where access is just not available to folks who are deaf or hard of hearing. And this is one more step towards creating just that, just access to a lot of different things that a lot of folks are just missing overall. So I am happy to entertain a motion.
Madam Chair, is it me or Representative Moore Green that's moving the bill?
Oh, I'm embarrassed. It's me, and Zoe sent me the paperwork, and Madam Chair, I move that we approve House Bill 2585.
With a due pass recommendation and to be referred to the Committee on Ways and Means?
Yes, please. Thank you. You're so gracious.
It happens. It happens. Without Zoe, we would all be in a world of hurt. Vice Chair Moore Green moves House Bill 2585 to the floor with a due pass recommendation and the bill be referred to the Committee on Ways and Means. Is there discussion? Okay. Representative Salinas.
Thank you, Madam Chair. I just really want to thank the sponsors of this bill and to thank my colleagues for entertaining this bill. I've been working on language access with interpretation, but I just really want to acknowledge that not all access is the same, right? And that this is a different area of access. And I'm so, again, grateful to the chief sponsor, Representative Noble, for bringing this forward. Because as I found out very quickly, like American Sign Language is very different in terms of interpretation than other types of languages. And so I'm sure this, the access for the deaf and deaf-blind is very different. So I'm really glad that we're really trying to dive in and figure out access for all of our various communities and differently abled people. So thank you, and thank you for bringing this forward.
Thank you. Any other discussion? Seeing none, clerk, can you call the roll, please?
Yes, Madam Chair. Representative Lively?
Aye.
Representative Morgan?
Aye.
Representative Reynolds?
Aye.
Representative Salinas?
Yes.
Representative Solman?
Rep. Solman votes aye.
Representative Wright?
Representative Wright votes aye.
Vice Chair Moore Green?
Vice Chair Moore Green votes yes.
Vice Chair Nose?
Vice Chair Nose votes yes.
Chair Sanchez?
Sanchez votes aye. And the motion passes. Closing the work session on House Bill 2585, and we will carry over House Bill 3123 to our next available slot because we do not have the paperwork for that bill. So at this point, folks, I think we are done for the day, unless there's anything else, Zoe?
No, Madam Chair, that was everything on our list.
Fabulous. Wow, we have some time. I'm amazed. Thank you all for your hard work. We'll let you folks know when we do see those amendments for 2086, because again, I think a very, very important bill. If you have an opportunity, I know many of you are so very, very busy that you might not get a chance to review that slideshow again, but I think it's really, this is an important bill, and it marries very well with several other bills, obviously House Bill 2949 and other things that we have in our committee. So just that. All right, we are adjourned, folks.
Thank you.
Thank you.
Bye.
Thank you.